Hope in the fight against childhood cancer. A new center is being opened at the Hani Baragwanath Hospital.
Well, it is estimated that about half of all children with cancer go undiagnosed. It's hoped that the Zakithi Nkosi Paediatric Oncology Clinic will remedy this. So let's discuss this with Stanley and Daphne Nkosi's Foundation, Zakhele Mashile. Dr. Zakhele, thank you so much for your time this morning. A very good morning to you. Certainly when it comes to being able to diagnose cancer in this country, though we are trying to move ahead with it, but really how are we faring in being able to even give the necessary treatment, diagnosis, and even just the support and care needed for cancer patients?
Good morning, Faith and your colleague, and good morning to your viewers. I think what is important is that when we started this journey, we realized the need to improve the infrastructure that is currently available at Baragwanath Hospital, and the fact that there was infrastructure issues that had disabled the professionals at Baragwanath from actually instituting cancer treatment. So if you look, the problem that we have in the country is that most of cancer patients come to our hospitals when it's already too late. So the late presentation is a problem, and when really there's very little that can be done. If you look at oncology centers, there are very few in the country. Para is serves the largest. If you look at the numbers that they see, they see from major provinces: Limpopo, Mpumalanga, Northwest, the Free State, the Northern Cape, and SADC countries, because they run the biggest unit in the continent. So when we started this journey many years ago, they have stopped doing certain, life-saving treatment like stem cells. So they have, with the center, the first phase being opened in 2019, they have seen huge, improvement in terms of patient outcome. So we have seen an improvement. They have restarted the stem cell transplant treatments, which are really life-saving. Those patients that have been saved from there, they would have succumbed from their illness. So we've seen a dramatic increase in treatment.
Dr. Mashile, you've highlighted a number of issues, that South Africa has been facing, especially children, where cancer is concerned. But I want to look particularly at one where you said, patients only ever get diagnosed with cancer when it's already late, perhaps stage 3, stage 4. Would that maybe not be a case of a lack of education, a lack of knowledge of cancer? You think you are sick because of, the ordinary things, TB and such things that perhaps you would be able to identify and not necessarily cancer. So could the issue not be that people just don't know what to look out for when they actually do have cancer?
Yes, you hit the nail in the head, education. To borrow from someone, they said, as medical doctors, in trauma, for example, when we fail to make a decision, a patient loses their life. But in education, when we fail in education, the patient leaves. And we all know what that means. So if you look at the levels of education in our country, it's a problem. So obviously, we are launching a campaign called Voga Para Voga. And this campaign, we intend to actually roll out a campaign of education to try and re-educate our people. Because remember, we have a lot of other beliefs in the country where people they still believe in other things before they go to hospital. So that's one of the reasons that we want to to harp on to encourage our people to seek medical help first before they seek other types of assistance from other beliefs. That's very important.
Dr. Zakhele, this story for you, and also when it comes to the oncology clinic, is a very personal one. It's not just about how is it that we can better the lives of South Africans, especially children, in the diagnosis and the treatment of cancer, but specifically when it comes to the Zakithi Nkosi Paediatric and Oncology Clinic, it's one that is close to the heart. Won't you just share with our viewers exactly why is it that this hospital even came to be?
But Miss Zakithi Nkosi, who was my sister, died at a tender age of 19 in 2016 from a rare blood disorder called HLH. And when she died, we're a family with a bit of resources. We could not save her life with all the resources that we had. So Mrs. Daphne Mashile Nkosi, who's the chairman of the foundation, decided on a journey to actually give life to those South Africans that are less fortunate than us. So during our discussions with the professors between Bara and Johannesburg Hospital, we were made aware of the dire shortage in the Haematology Center in terms of infrastructure, which had collapsed over time, and the fact that the drainage area is so huge in our country. So with the challenge of infrastructure, she saw it fit to actually look at empowering Chris Hani Baragwanath by building a Haematology Center, which is the first phase. First phase, Zakithi Nkosi Haematology Center, comprises a hematology clinic and a ward. And a ward comprises of two, male side and the female side. Each side is a 10-bedded, highly specialized ward. So it's a 20-bed capacity with about 10 ventilators, 8 active and 2 on standby. We also have dialysis machines because more often than not, these patients require both ventilator and or dialysis. So that center has been operational since 2019. We've seen, I think, the head of internal medicine has said they've seen over 2,000 patients since this center was opened. It has enabled them to restart what we call fellowship in hematology, to train new specialists in hematology. In the country, we currently have 36 adult hematologists in the country. So they have restarted training more hematologists in the country. So this center has actually enabled that capacity that we had lost over the years. So with the launch of the second one, which is a pediatric oncology clinic, we plan to actually move the current pediatric hematology clinic where it is into the new center. So we plan to do the third phase, which would be a pediatric adolescent ward, and a fourth phase, which would be a research center, where we hope that with the research, we will improve on current patient outcomes.
Dr. Zakhele Mashile, all the best with the rollout of all of these programs, and I think South Africans, particularly, the people that frequent the Chris Hani Baragwanath Hospital, are grateful, that this fight against cancer, is progressing at the rate that it is. Thank you so much for joining us also.